Okay, hi everyone. So in this episode of the vlog series, we're going to talk to you about clinical attachments. So what is a clinical attachment, why it might be beneficial for you to apply for them, and how to apply for them. Okay, so a clinical attachment is often a really good way for an international doctor to gain some exposure to the NHS system without actually doing the job of a doctor here. So the first thing to note about what actually is a clinical attachment is that you would never be left to see patients unattended, unsupervised. You would generally be doing things like observing a consultant, potentially taking some notes, medical history, that kind of thing. Rarely physical examinations, but if you were to, it would be under strict supervision of a consultant. Okay, so the next question is it something that I have to do? Do I need to do a clinical attachment, and will it be useful when applying for jobs in the NHS? The answer is it's not essential. No one's going to look at you unfavourably if you haven't done a clinical attachment. However, if you can put it on your CV, it does show that you'll have some knowledge of the NHS systems. So when you arrive, of course, it's going to be a lot easier for you to settle in because you'll be aware of many more of the protocols, you'll be aware of the system, the interactions within the NHS and all those things. So it's definitely a good thing to have in addition on your CV. And lots of other doctors do tend to apply for clinical attachments when they're already in the UK doing their PLAB exams or maybe their Royal College exams. So it's often seen as a good little extension of your visit visa and something to do for an extra week or two, which is going to enhance your CV ready for when you're making those applications and you've got your GMC registration. So how to apply for a clinical attachment? Well, the first thing to note is that these aren't jobs that usually get advertised on NHS jobs, and they're not something that an agency can help you with, sadly. They do require direct applications and direct approaches to hospitals. So if you type into Google the words clinical attachment and the hospital you're looking to work in, usually there is a little bit of guidance and an email address that you can contact, usually in the HR department or perhaps directly in one of the clinical departments, and they will get back to you to try and arrange a time when there's a consultant available who you can shadow or a senior registrar available who you can shadow. They do tend to come back to you as well because they see it as a good opportunity to meet potential candidates who might be interested in working with them in the future. So it's well worth making those direct approaches. Okay, hopefully that's been of some interest in telling you a bit more about the clinical attachment system in the NHS. Best of luck if you are applying for a clinical attachment. If you've already done one or if you haven't, but you are looking to work in the NHS, please do get in touch. As always, Gabby's going to put the contact details up at the end of the video.